our situation now where we're not having any new podiatrists applying to come practice in the state of Alabama. In Mobile alone, when I started practicing, there was 13 podiatrists. Now we're down to 6. It's a much needed service. And again, we're not asking for anything outlandish here. We're actually giving up a lot that surrounding states actually have in Georgia and Florida, just to get the necessity that we need to be able to practice. I came in here practicing under a 3-year residency and knowing good and well what I was facing and up against. And I love what I do. I would do it all over again. But if I were to talk to a new graduate right now of a residency program, I don't know that I would encourage them to come to practice in Alabama under our current scope of practice. So we're definitely missing out a lot on people that can serve a need here that is definitely necessary. So thank you.
Thank you.
Representative Wingo.
Good morning, Mr. Chair and members. Good to see you all. Listen, I wanted to speak when I heard that we were taking this bill up. As one of your fellow legislators, I have had 2 total ankle replacements. I'm not proud of that, but I have, as a patient, possibly. My right ankle was done 14 years ago, total replacement. My left ankle was done 19 weeks ago. And I am blessed that I can walk. We are very fortunate to have some of the best surgeons in the United States here in Alabama. Ankle replacement is it's an extreme, difficult, and complex surgery. I'm told by many doctors that shoulder, knee, hip replacements do not compare to an ankle replacement as far as the complexity and the pain. I will tell you that it's extremely painful. When you have the surgery, you are off your ankle for at least 6 weeks, and then you're on crutches, wheelchair, and rehabilitation on and off for a year. And so I'm in the middle of it right now with my right ankle. Very few orthopedic surgeons will do ankle replacement because it is so difficult. Each time that I had my ankle replaced, I searched the Southeast for the best, and there's very few good ones, and that's a good thing, guys. That is a good thing. You want the best doing something so complex, and in Alabama, we are blessed to have a few, and those few are the best. And so just keep that in mind. I hope that you've had a chance to read these letters. I have. They were given to me, and please take time to read them. I would encourage you to read them. These are from the best doctors that we have, and they give clear and very simple direction as to their thinking. So please listen to them. These are medical doctors and who understand the entire body, and that's key here, is that a medical doctor, an orthopedic surgeon, understands the entire body, not just the foot. The medical doctor understands the Achilles interacts with the knee, and the knee interacts with the hamstring, and the hamstring interacts with the hip, and the hip, the back, and all of these are connected. My problems began when I was a senior at Alabama. I got hit in the back, L2, L3, L4. My rookie year at Green Bay, I had a laminectomy. And that's where they go in and they took out 13 pieces of disc. 40 years ago, a neurosurgeon told me, Rich, you're going to struggle with your hips, your knees, and your ankles one day, because he knew the entire body. I've had 2 hip replacements and I've had 2 ankle replacements. Unfortunately, he was correct. My point being is that it's important that we are talking about medical doctors, not just a foot doctor, that they know the whole entire body.
Representative Wingo.
Okay. I'm sorry.
You're
it was
good.
quick,
That
and I
was
was
quick.
trying to.
Okay.
Thank
Thank
all.
you.
Dr. Fillinger.
I believe, just before you start, I believe those letters all, and some of them are in your, maybe handed out, but all those letters were emailed to you yesterday. So, yes, sir. Okay.
Mr. Chairman, thank you. Committee, thank you for considering us. It is such a privilege to be able to address you today. Growing up, we teach our kids good things come to those that wait. Be patient. But sometimes you can wait too long. And that's where we are as a state of Alabama. We are on the cusp of waiting too long. This profession, which has been proven over and over again, the value that podiatric medicine is to the medical team. It's dwindling in this state because of the lack of scope. I have spent many hours, many days investing in young people who've chosen to go into this profession. One of them was a high school student at Coleman High. That's where I practice, is in Coleman. I've been there for 23 years. Upon completing high school, went to college. Upon completing 4 years of college, like we all do, he went to medical school. Now, there are 10 podiatric medical colleges. It is medical school. They are all integrated with MD-DO programs. We use the same textbooks. We read Harrison's Internal Medicine. We do know the entire body. We don't just study the foot. The foot is attached to the body, and yes, it does have effects elsewhere, and elsewhere will affect the foot. Upon completing that, he did a 3-year residency at The Ohio State University with some of the best foot and ankle surgeons in the country. Upon completing that, he did a 2-year fellowship in limb salvage. I asked Andrew if he would come back to the state. I had invested so much into him. And he said, no, I can't do half of what I was trained to do. And so now he is a professor at the University of Cincinnati, training residents there. I know that there's a lack of knowledge about what we do because there's no training programs here in Alabama except for the VA here. Because in the VA, you can use any state license to practice. But the scope of practice restricts us from training other doctors because we can't train that ankle. Standardized training for us includes the ankle. When you look at Medicare statistics, the most recent year that's available is 2018. There's something called the BMAD, and that's where they do a statistical analysis on every procedure that's done across the country. 30% of all ankle surgery, 30% of it is done by DPMs. DPMs perform ankle replacement all over the country. They do have that training.
Time.
Thank you.
Thank you.
Nico Corley.
Mr. Chair, members of the committee, thank you for this time this morning. I will not take the 3 minutes out of respect for the committee and respect for the rest of the work you have to do here this morning. I do want to bring attention to the letters that Representative Wingo referenced earlier. Those were emailed out yesterday. Those are from orthopedic surgeons, foot and ankle specialists from across the state of Alabama, raising concern about primarily the educational differences between medical education and podiatric education, between the residency programs that are in existence now for podiatric medicine and the residency standards that have been in place for almost 70 years now for orthopedic surgery. As well, there is video testimony in that email from one of our top foot and ankle surgeons in the state from Birmingham. He could not be here this morning because of his surgery regimen and surgery schedule. So thank you for that time. I will certainly defer to the expertise in those letters and to the testimony from Dr. Michael Johnson. And thank you for the time this morning.
Okay. Thank you. All right, ladies and gentlemen, in your packet you will see that there is an amendment that will go with this to extend it to 36 months. Next week it will be on the